Welcome to Pharmacy Friends, a podcast dedicated to bringing industry experts to the same virtual table to talk about what is happening in pharmacy today, what is coming in the future, and most importantly, what it means to you. On today's episode, we are diving deep into emotions and technology with Brian MacDonald, a passionate pharmacist who has learned over the pandemic that filling a prescription for loneliness may be the most important thing for patients during these times. But how do we do that? Well, Brian's joined by Eden Brownell from mPulse Mobile, an organization dedicated to developing high-touch solutions that use a powerful combination of conversational AI, behavioral data science, and education to improve health outcomes. Let's get right into it.
Hi, pharmacy friends. I'm Brian MacDonald. I am the Director of Specialty Clinical Strategy here at Magellan RX, and that involves overseeing, helping to implement and develop a number of clinical programs and strategies, looking at specialty medications and high-cost therapies on both the medical and pharmacy benefit, both payer and patient-driven solutions. And one of my responsibilities is to help oversee one such clinical program in which a team of nurse care managers regularly interact with our specialty pharmacy patients on a daily, monthly, weekly basis, depending on where the patients are at in their care journey, and to help them meet sort of the needs of their condition and of their treatment. Through this work with our team of nurses, I hear a lot about how patients can feel isolated during times like these, especially while also trying to manage a complex and often chronic health condition. So in the middle of this pandemic that we've been going through, it's hard for any of us, I think, to naturally feel a little bit more isolated and perhaps lonelier than we did before. And perhaps you didn't even realize that feelings of isolation and loneliness can manifest in your physical health in terms of detrimental effects on your health. There have been recent data and results that have been published around this topic that can equate the effects of loneliness on more commonly recognizable sort of physical health barriers, things like increased risks of heart disease. And some people have also linked loneliness to detriments that are comparable to that of obesity, or even something like smoking 15 cigarettes per day. So because of that, we at Magellan have been looking at different solutions and different ways that we can connect with our patients beyond their treatments, beyond their prescriptions and their specialty medications and their conditions, to tap into those feelings of social isolation and loneliness. And one of the ways we did that was through our partnership with mPulse. And today I'm joined with our special guest, who is Eden Brownell. She's with mPulse, and mPulse is an organization that focuses on using technology to mitigate these types of emotions. So Eden, thank you so much for joining us today.
Yeah, thank you. I'm so excited to be here. My name is Eden Brownell, and I'm a behavioral strategist on the engagement strategy team at mPulse. My background is all over the place, but in psychology, sociology, marketing, and behavioral science. This really boils down to the fact that I am super fascinated by people and their behaviors and learning about, why they do what they do and why they might not do what we want them to do.
Yeah, that's such a great point. And as a pharmacist by training myself, we grow up and we're educated to sort of be experts in the medication treatments, the pharmacologic treatments, the idea that there is hopefully a pill or a capsule or an injection to sort of cure what ails you. And whether it might be a symptom or a slowing of a disease, things that you can sort of tangibly measure and tangibly feel. And so little did I expect, this far into my career to start being more focused in some of the intangibles, those emotions, feelings that connect with our patients and ultimately, play as much or perhaps even a larger role in their overall health than those treatments and those conditions do themselves. So thank you again so much for being here. I think this is an awesome topic for us to tackle. I'm really excited to talk kind of about a variety of things with you and do a deeper dive into some of what we were just covering. I'm a podcast junkie myself, so in preparing to host this episode, I went back and I was re-listening to an episode of Freakonomics, which is obviously a much more widely listened to and downloaded podcast, but one that certainly has been established in the market for some time. But they recently had an episode themselves that tackled social isolation and loneliness and touched on some of these same outcomes and same topics. And so they, one of their guests was Dr. Vivek Murthy, who is now our 2-time U.S. Surgeon General and who's been at the front of a lot of this research. And they were talking a lot about the differences between social isolation and loneliness. Those words are often sometimes used interchangeably, but they're not the same thing. And they go on to talk about how loneliness is is subjective. One of their contributors to the episode described it as the difference between what our actual level of social connection is with the outside world or with others, and what our desired level is. And that difference between those two is where that gap is loneliness. And it's that loneliness that really is tied to a lot of these sort of detrimental health outcomes, the comparisons to, the cigarette smoking and the obesity and things like that. And so, the idea that you could be socially isolated but not lonely, you could be lonely but not socially isolated, vice versa, that those are actual scenarios that our patients might be in. So I was wondering if you could maybe expand on that a little bit with some of your thoughts on the differences.
Yeah. So I think for a lot of what we're seeing with the loneliness, is, people can be, surrounded by others or not have others and still, like you said, it's still the feeling that can be there. So I think it's really important when we're able to determine that about someone and therefore provide interventions. And I think in this area, you think of interventions and they can seem so clinical and wild, but we're really talking about humans and basic needs and, connection just being one of those aspects. So we don't, when we think of an intervention for this, it's really just letting people, in the most part, know that they're not alone in these feelings, especially right now in a time when you can feel very alone. And I think it's just, that power of hearing that other people are going through the same thing, and, sort of tips and tricks for, how they're sort of getting through the process as well. So I agree. It can be a very interesting topic. People who you wouldn't assume might feel lonely that really are, because it is just sort of that subjective feeling.
Yeah, that's a great point. And, when you think about it, and, when you hear people describe loneliness as a biological driver, something on par with hunger or thirst, or some of those other sort of just natural, innate sort of desires and cravings that we have for survival as humans. And you think about the social connection piece as being what's tied to longevity and those more positive long-term health outcomes. Can you tell us a little bit more, at least, about what mPulse is doing in terms of leveraging technology to help people with this?
Yeah, so mPulse. So we really build solutions that are on our conversational activation platform. So it really works to power these large-scale outreaches through omni-channel messaging delivery and supports two-way interaction. And, in many ways, more personalized content that's tailored to the individual. So a huge part of it is really, and I think you hear again and again from members, is we're really trying to respond to them and meet them where they are. So this is especially relevant with this topic because it's sort of what's going on right now. So we're, really trying to be conscious of, barriers that members are facing with their healthcare. Our solutions, you can see that sometimes a solution could be from, really this straightforward, here we go. And the problem with having, sort of we're getting members from A to B and no wiggle room in between, it really leaves out that, sort of gray area of just natural, of being human and people are busy and people have other things going on. And so our system is really allowing for the ability to handle those different scenarios. So, we're really trying to get member from point A to point B, but at any time, if they are to mention something related to, transportation issues or cost concerns or access or trouble getting an appointment, our system is listening and really prepared to respond with appropriate resources, depending on the barrier mentioned. So really getting at, the social determinants of health and what's happening, in the member's life outside of just, the healthcare things that we're trying to do. So we're really trying to establish where they are in their healthcare journey, what might be going on and getting in the way. And being, I think a huge aspect is just empathy. I myself can struggle to get to healthcare appointments and I work in healthcare. I think a lot of it is complicated and there's a lot of jargon and it can be overwhelming. So I think we just really try to bring that to our conversations and never really pointing the blame or things like that, but just really helping members figure out what's going on and really just try to provide, supportive messages. And I think a huge part when it comes to feeling lonely or isolated, it's a sensitive topic and not something that maybe someone's going to come out and talk to their doctor about. We would love to think that everyone has this peachy keen relationship with their provider, but not everyone is like ready to open up about topics like this, or they don't think that they should with their doctor. They're sort of like, I go in for my annual, anything health related, but people still haven't started thinking of their doctor as someone that needs to hear about, some of those like other issues. So I think a great thing about what we're doing is with the technology and the digital tools, and we're asking it and we're introducing it in that really like sensitive, empathizing way. There's like a lot of research that people are more likely to open up on sensitive topics through these text messages and digital tools. They feel a little bit more of a judgment-free zone. It's not as intimidating. They're just kind of opening up, and we're constantly sort of reassuring them, that their answers aren't going to impact anything. I think that that's like a huge piece, is just having the technology be able to create that judgment-free zone that really helps us to get a clear picture of where members are.
Yeah, you make a couple of really good points there. You got me thinking. As a pharmacist, I often I have to work with and work around sort of what I presume to sort of be that sort of baseline foundation of knowledge about health that not everyone has, that I just, it's almost like an expectation that I even subconsciously project onto other people when I'm the one fielding questions from my wife, my parents, my sisters. Something that I always have to kind of circle back to and be aware that like, oh yeah, not everyone has, this day in and day out hands-on experience that I happen to have in my current role. And so, be able to not just relate, but then be able to distill some of this complex information down into a way that's easily sort of understandable and less intimidating is so important. And then you brought up another part that made me think in terms of the blending of physical health and mental health, as opposed to knocking down some of those fictional barriers that have been sort of built up in between the two and have kept them separate for so long. I don't know if you're a huge follower of sports, but I feel like sports has sort of done some of that recently, thinking about what Naomi Osaka has done in tennis, thinking about, so I love golf, and there's a golfer, Bubba Watson, who's been so outspoken about his mental health and how it's impacted physically and in his performance and in his daily routine. I think about Kevin Love, a pro basketball player, just as a few examples of really trying to dilute that separation that has existed for so long between what's considered physical health and what's considered mental health.
Yeah. And I think that goes back to being able to deliver that message that you're not alone. So the impact that these, public figures are having by just admitting it. I think, when you're going through, I think it's, it's isolation. It's, it can be anxiety. It can be depression. There is still a stigma. I know we're all working against it, but I think when you have you have people coming out and being outspoken about it, or you can, have a conversation with a member and you're able to say, a lot of other members are dealing with this, this is how they're getting through. I think it just kind of pops that bubble of like, it's okay to feel this way. Other people are feeling it too. So I think that the more that's coming out about it, I think the better. Just it's really, I think, doing a lot to help folks that are really going through it.
Yeah, that's a great point. Now, thinking about the technology itself that mPulse has available and that mPulse uses, when I first started interacting with the mPulse team, it was to move some of our clinical programs for patients away from the traditional modalities of, telephone outreach, snail mail letters to them, and then maybe a fax to their doctor. And then, we were able to start first with the traditional sort of text message interaction with patients, and then sort of refine that in a way that was a little bit more, two-way instead of a one-way response. But recent solutions and pilots that we've done with mPulse have introduced me to levels of interaction and different varieties of offerings that I didn't even know mPulse had available. So in terms of the technology, could you describe a little bit what it actually looks like for a person who's engaging with the platform?
Yeah. So I think that this goes back to, we're really trying to meet members where they are. We're really trying to be like cognizant of just what people want right now. People are on their phone. People are still busy when they're on their phone, but they are on their phone. I unfortunately, I think for some cohorts, you are potentially able to still get through with a phone call, but I think that everything that occurred throughout COVID, the world got more skeptical and a little less trusting, in terms of like, there was a lot of spam calls going on. There was a lot of just concerns about that. So I think it's become even more tricky to try to call someone and get them to answer. If you, I know for myself, I don't even answer some of my friends' calls. I'm not a phone person. Maybe you'll catch me on FaceTime, but the world is really just, in a texting place. And so I like that you pointed out sort of the difference between one way and two way. So, it's great to be able to say to a member, hey, go do this thing. But if you are just in a one-way message and you don't allow the member to respond, like, you're really missing like the possibility of getting at barriers, at getting at issues, at getting at the why they're not doing it. And it, can be, big. I don't have transportation to, like, I just don't know why. I don't feel the need to do that. And a lot of our members, when we look at barrier analysis, a lot of it is just it's like an information, it's a knowledge gap. It's something that we wouldn't have discovered unless we allowed for that two-way communication. And unless we were able to like sort of build in the background the ability to capture those different pieces and actually, direct members to resources. So it's interesting with texting because also if you sort of have a more limited one-way sort of connection, they've shown in research that like 75% of consumers are actually more frustrated when they can't respond to a text message from a business due to sort of those limitations and, certain kind of texting. So, if what we really like about our technology is the ability for the member to be a real human and respond as they want to. So yes, we're gonna lay out, okay, like are these 1, 2, 3, 4, are these maybe the things you're struggling with? But we in the background have a host of things that we're ready to respond to because we know that they're also issues. And a member can say, go down one of those paths and our system is still allowing for it. So I think that that's just a really huge aspect of just understanding the degrees of issues that a person can experience when it comes to their healthcare. And I think another piece that we can get into is I think especially relevant to the work that we did here and sort of pushes the boundary, when it comes to like when you just think of a text message, is we've been really interested in the work around photonovellas. Yes. And huge part. We see really great research around that and also just the data. So it started out of, we really see that the Hispanic immigrant population in the United States is constantly growing, being mindful of that. So there's been all this research around how photonovellas are a really great way to convey, health topics, that like a picture format or story format is going to be easier to consume and engage with. And so it's really, understanding the need for more adequate healthcare services and allow members to understand it and get that knowledge. So it's really a health literacy tool. So like we talked about before, where, we can get in our mind where, we think everyone has maybe the same knowledge that we do about health because we work in it. This is sort of the understanding that not everyone does. And so it's really meant to be a health literacy tool that can be adapted and used to increase low health literacy rates and access to care. And it's really was specifically among low income, monolingual Spanish speaking communities. So really trying to make sure, but what we've seen is that it's working everywhere. So I think it really speaks to, the changes. You see things. I mean, I think of like younger populations, we have the TikTok, we have stories on Instagram, and people are really used to, and I think hungry for that like visual communication. So I think with photonovellas, we're really trying to, make learning about healthcare, sort of fun. And, not just, oh, here's a huge chunk of content we want you to read about and really hope that you understand. So I think that that's been a really great aspect of photonovellas.
Yeah. So when we did our most recent pilot, looking at COVID-19 messaging for our specialty patients, focused on social isolation and loneliness. And when I got to see sort of the library of content that was going to be rolled out, there were dozens of topics. that were one-way messages, two-way messages, and these photonovellas. I have to admit that my gut reaction seeing the photonovellas was, gee, I don't know, like, is it a little too corny? Is it a little too after school special, PSA? I didn't know what was going to come of it. When we got our data and our results back, it was not even close. The photonovellas were the most engaged with and the most highly rated in terms of patient satisfaction across, age groups and, social determinant of health brackets and buckets. So, I mean, I'm completely wrong.
No, I think that your initial gut feeling is right. I mean, I think when I'll nerd out quick on my behavioral science, but people want easy. There's this concept of perceived effort in behavioral economics, and it's sort of the difference of the objective effort versus the subjective effort of something. And I think when you could provide the same amount of content in a just large text message, or you could bundle it up into a photonovella and it's kind of broken up and it's chunked, and it's they are able to see the progression that they're making through the story, which provides them a sense of sort of accomplishment. And it's they end up they might be learning or reading the same total amount of content, but just the way that it's being delivered, they feel that it's easier. And when people feel that something's easier, they're more actually to like it. So that's, I think, just a really great part of photonovellas, is that people, they don't feel that it's difficult, and they're learning in the process.
That's a great point. And it was so helpful to see levels of engagement, levels of satisfaction broken out, not just by the cohort, just to have a generic result like 90% satisfaction or 50% engagement, but to see it stratified amongst decades of age ranges, or broken out by social determinants of health. So I wanted to specifically kind of focus on the latter in terms of the social determinants of health, how we go about sort of analyzing patients by where they're at geographically, and sort of the importance of doing so.
Yeah, so I think a huge part of it is, we were really getting at personas for members. So based on, data that we were getting in, based on what they were saying throughout the conversation, really being able to pivot and tailor the communications for those members. I think that we, for more high risk members, we did see that they were very satisfied with it. They were finding it helpful. I think that what we found to be very interesting is that even those who were low risk for social determinants of health were still finding this very interesting. So it again goes back to that subjective feeling of loneliness and isolation. Someone can be, sort of, okay, we consider them to be like economically okay. And, in our society, sometimes that's what people think is like, that's it. That's the end all be all. They're doing great. They should be happy. And it really is, this idea of loneliness is something that is pervading all of the levels of, sort of our society. It's not, it's not economically specific. It's people no matter what can be feeling isolated. And I think that was something that was really, interesting to see repeated in the data.
Yeah, and speaking of that data, let's zoom out even a little bit more. I know I was just referencing the fact that in our two rounds, our two cohorts that we've reached out to, we saw some really positive results and some really interesting outcomes. But more broadly, can you speak to sort of what mPulse has seen in terms of the results and trends?
Yeah, of course. We ran this across two cohorts. So really in 2020, and then, which was, at the height of everything going on with COVID. And then again in 2021, what was a alarmingly awesome, finding is that people were still similarly like strong engagement rates in the 2021 cohort. So even as things were starting to open back up and people are getting back out there, from their responses, we were seeing that they still found this program valuable. They found the interactions helpful. Like even as the, pandemic shifted from lockdown opening up. So we saw that the overall program satisfaction, members continue to find the program helpful, with almost 90% finding it helpful. So again, really similar to 2020 and huge satisfaction numbers, which, we like to attribute to the messages, but also, the photonovellas that I think people just found really enjoyable and helpful. And in terms of overall member insights, and if we thought about like the behavior change, we thought that members would be reporting more concerns around the Delta variant or rising COVID cases. But most members were actually just talking about how they've learned to cope, how they're finding our check-ins and tips helpful. And so again, we built in these abilities to, be mindful of what's going on. We were ready to react to people mentioning those things. But at the end, they just kind of continued to show that they were finding it helpful and that they just were giving positive feedback about some of the, behavior change and tactics that they had learned when we asked them at the end of the program. It was a high engagement rate. We were at like 64%. We saw members clicking the links at about 14%. And the age band that was sort of most engaged was between 50 to 70. And again, this was super similar to 2020. And what we found interesting is that we still were seeing engagement across the other members, and they might not have been clicking as much. So I think one of the great parts is, for the younger population, in all of our programs, we have the ability to opt out. You have to give people, you see it in any text message you get, you have to have the ability to say stop at any time, and members can do that. So same thing, we always provide that out. People have to have a feeling of choice and autonomy, and they can't feel stuck. So even with the younger population, they weren't clicking as much, but they didn't opt out. And I think for us, that was another big win, because to me, it says, okay, this content's still helpful. They're still reading it. It's still on their phone. They don't want to stop the messages. They might, be doing 8 million other things and be on their Instagram and their TikTok, and they might not click through, but they're still getting on their phone and reading and not opting out. What was really great to hear is that more members were reporting really healthy coping strategies. So they were exercising more. They're doing outdoor activities, just walking, gardening, whatever it might be, eating healthier, and just like feeling happier and positive. And that was sort of at like the check-ins and at the assessments at the end of the program. So it was just really great feedback to see that, members were so involved, and they were actually, these text messages were having impacts on, their day-to-day life.
Yeah, you mentioned the option of opting out, and obviously that's built into any strategy like this. What was really encouraging to me, it was exactly the same in both rounds that we launched the pilot, is that the pilot was designed to last 6 weeks. And we saw like 85 to 90% of all opt-outs occurred in that first like 7 to 10 days of the messaging. And I think that's exactly when it should happen. And it was really awesome to see that anyone who sort of opted in and decided to stick it out, for the most part, made it all the way through the 6 weeks. And so that really landed with me, because it spoke to how good the content was. If people didn't think that the solution was right for them, they recognized it up front and they opted out. No big deal, totally understandable. But for those who stuck it out, there was no dwindling interest. There was no changing, almost like no changing course or reversing course and saying, actually, never mind, this isn't what I signed up for. No, thanks. The patients stuck it out. They went through the 6 weeks, and it was awesome to see the patient satisfaction and a lot of the subjective feedback that came in terms of the new mindfulness habits, the new routines, the new hobbies that people were trying to implement in their life. And then, even seeing specific messages from patients coming in saying it felt so nice to know that my specialty pharmacy was reaching out to talk more about just my prescription or more about just my, specialty condition, that, they really wanted to see how I was doing. And so, to get that sort of feedback, really, just warms you. And it was awesome to see. It really justified the whole approach. And it was so interesting go through round one versus round two. To be perfectly honest, when we started to do round two this past summer, I had a lot of concerns that it was almost too little too late. The vaccines had started to roll out. States were lifting some of their regulations and restrictions. And I said, sure, let's offer it. It can't hurt. But I wasn't necessarily so hopeful on what the results or the data might be the second time around. And to see that engagement was on par with what we saw last fall, to see that opt-outs were nearly just as low, that patient satisfaction was still just as high, was really compelling. And that, speaks to that these topics of social isolation and loneliness may not have been, as tied, to the pandemic, directly as maybe we thought. And maybe they're topics that are worth discussing all the time and not just in time, earth moving, changes and pandemics. So that's what really kind of stuck out to me. It's what really, justified the whole approach, the whole strategy, made it so worthwhile to have done it. So if we think about how we can apply this moving forward, kind of what, in your opinion, does the future look like using this type of technology to impact people's health in a way that might be, positive and meaningful?
Yeah, I mean, I think that the program results, that really spoke to me as well, that we were, sort of right in the height of COVID 2020 versus, July 2021, members were still feeling that the program was so helpful. We had, over 60 member responses where we just kind of asked them, what was your favorite aspect of this? And we had things like, I had a change in attitude, knowing I have an extra layer to my support system, really speaking to these text messages. Another said, the text, it showed me someone that doesn't know me cares. So that shows that, people can think digital and technology can be this really cold element. But I think if you infuse it with the right content, it can really be this great empathizing sort of additional character in someone's life, and be something that they really connect to. I think we, need to always understand that loneliness wasn't created by the pandemic. It was happening long before, and, they were starting to do this research. I think, there's not a lot of positives that can come from a pandemic, but I think if it's allowing loneliness and isolations to sort of get in the spotlight and be understood, that's sort of one great takeaway. It's like, how do we keep doing these interventions, knowing that people are still finding it helpful, knowing that, as people go back into society, there's this new normal. And I think, everyone's going to struggle with that. And, the feelings of isolation, and none of that's going to go away. So I think it's just, being really mindful of that. I think when we think of actual messaging and things, when we're shifting more to, out of lockdown and opening up and stuff, it'll just be a switch in content framing. So I think we can remove a bit more of some of the COVID stuff and just have it be these friendly check-ins that are just about life, and, and letting people know that it's okay to have these feelings outside of a pandemic, that this does happen. Again, just like reiterating that you're not alone, and you know what I mean? And other people are feeling it. I think that's going to be really important as we go back, is that are people going to feel guilty if they're still feeling lonely as things open back up? And it's just like, there needs to be no judgment there. That is what it is. People will feel lonely regardless. And so I think that the pandemic obviously really impacted our social lives, but it's also really primed us to, develop new relationships. And we all, as sort of a collective whole world, we all, being lonely and isolated is now an experience that all of us are uncomfortably maybe familiar with on some level. And I think that what I love about, that is that it can make us all better empathizers. And I think it ultimately will lead to more research around it and attempts to solve it. Because at the end of the day, we're all human. And, we understand now, I think more than ever, that the importance of connection and, sort of being able to, have your people and things like that. So I think these messages, I don't see an end to them in sight. I know we're constantly, we're already thinking through ways that we can, improve it and make it sort of, post COVID and pandemic, and just keep the good, happy engagement rates going.
Yeah, you're so right. I mean, this experience has been so valuable to me. I'm so glad to have been sort of spearheading this campaign from the Magellan side. And I know it's really made us think about exactly how we can take some of this learning and some of these opportunities and reapply it to our program overall, and think about the way our nurses are interacting with our specialty patients, and moving past or moving beyond just the traditional drug and disease education that we've always sought to provide, and being able to layer in that sort of behavioral health, mental health topics on top of it to make a well-rounded, comprehensive conversation with our patients.
Right. I think that when we've been thinking about it, it's like, okay, we same as social determinants of health, where okay, we're now starting to include that in all outreaches, or reaching out to someone about their management of their medication. But okay, we want to know if cost is an issue, we want to know if transportation is an issue, and I just think we're getting to a place where it's going to be like, is loneliness, like, are you feeling connected? Like, that is going to become another like new barrier question, because I think it's pervading all aspects. And so I think, it's just being able to then, okay, if we find that about someone, are we able to then, add them to the, isolation program, start providing them with those tips. So, really from other aspects of their care, discovering these type of issues, and then, getting them the right resources.
Yeah, you make a great point. It just reminded me, when we do our interactions with patients, our nurses, are sort of trained and are knowledgeable to look for certain, what we call barriers to adherence, and things that might get in the way of a patient sort of optimizing and getting the most out of their therapy or their treatment. And typically when we are looking at some of the data and some of the barriers that our nurses are identifying, it's a lot of the traditional things that kind of rise to the top. It's side effects, it's cost, it's maybe a little bit of health literacy, which is definitely a more common term than maybe it was 10 or 12 years ago. Health literacy is, I think, much more identifiable now. But one of the smaller slivers has always kind of been one that we had termed lack of social support, and we would see it in some cases, but not nearly as much as some of those other sort of aforementioned categories. And I'll be really interested now, post, social isolation, texting, post pandemic, to see if that's a trigger or something that we start to pick up on, either in terms of perception and being able to read between for patients, or something that patients are more comfortable just outright telling our nurses is impacting them. And I'll be really interested to see if it grows, not because of a worsening of the issue, but maybe more of a willingness to discuss it, if that makes sense.
Right. And I think it's like sometimes in how we frame it, people might see social support as one thing, and, feeling lonely as another. So I think, like you said, it's like your nurses who are, really in the thick of it and communicating with members. I think that they'll find these opportunities of, like you said, reading between the lines and being like, I think that this is an issue for our members, and just, having ways to sort of like sensitively talk about it. And like from that thing of, many members are going through this, sort of, how can we help you? And I think that that's, going to be part of the great part is, sometimes the struggle of getting at the right answer is just asking the right questions. So lots to think of for this one.
Totally. Yeah. We'll be continuing to just sort of think of and evaluate the ways that we can kind of use all of this technology that's at our fingertips the right way. And whether it's delivering kind of small tips or tricks to check in with patients and sort of help shape their mindset or their perspective, or if it's something, in terms of a larger solution that could start as a text message and help patients, kind of turn that into what ends up being better exercise routines, more positive sleeping habits, things, beyond, what's prescribed, by their doctor on paper, so to speak, and really helping them kind of find more meaningful ways to, take on new life skills or sort of be more proactive in the management of their overall health. So much to think about. Eden, thank you so much for joining us. This has been such an awesome conversation for me. I'm happy to be part of the Pharmacy Friends podcast, and really thank you so much for taking the time to join us.
Yes, it was so great. I hope you all enjoyed listening.
Thanks. We'll talk soon.
All right.
What a great conversation about how we can use technology to help address loneliness and isolation. I think a key takeaway here is that feeling lonely and isolated isn't just something people started experiencing because of the pandemic. As Eden and Brian discussed, it is an ongoing issue that can correlate to some pretty serious health concerns. Whatever we can do to help others cope with these feelings is so important, and using technology that patients are already comfortable with to engage with them and provide support is the path forward. We hope you enjoyed this discussion as much as we did. We thought it would be nice to assign some homework at the end of this episode, and don't worry, it's not too hard. It's just simply to reach out to someone you care about. The fact is, we are all dealing with these feelings together, and it's always nice to have friends by your side. As always, make sure you subscribe and rate this podcast 5 stars. We'll talk soon.